Now, diabetes, it increases your risk for many serious health problems, but for men in particular, unwanted and downright embarrassing complications can happen. Here with more is Dr. Mark Leo, Director of Operations for Urology Specialists of Nevada. He's also the Clinical Assistant Professor of Surgery at the University of Nevada School of Medicine. Doctor, great having you back. Welcome in.
Thanks, Sean. Good to be here.
So let's talk about the impact that diabetes has on several men diagnosed with the disease. Obviously, diabetes in its own right, a bad thing. You have to manage it, but there are unforeseen consequences as well.
Very common problem. You know, everybody that's had a family member or a loved one with diabetes is well aware of the effects on small vessels in the eyes and the fingers and the toes, but what they forget about is that it really has an effect on sexual function as well.
So why then do men with diabetes have erectile dysfunction? What's the link here?
The poorly controlled glucose levels in the blood will actually cause oxidative damage to small vessels and small nerves that are responsible for normal sexual function and blood flow. And that's the etiology of how diabetes has such a great effect.
Are men with diabetes more likely to develop ED earlier in life than men without diabetes? Is there research? How much earlier?
They are probably about 10 to 15 years earlier than the average man would. Yeah, it's a fairly significant number of men with diabetes that will ultimately have sexual dysfunction, up to about 75%.
And it really, for a man, that can hurt.
Can be devastating.
Yeah. So what are the treatment options available? I mean, it's not all is lost if that is to happen, but you do need to have treatment to.
Correct. Like everything, we always start with lifestyle. Obviously, a heart healthy diet, good control of the blood glucose will always help, but most of the time that's not successful in actually taking care of the problem. But the good news is we do have options, multiple options. There's oral medications that just about everybody is familiar with. Yeah. They work.
We've all seen the commercials with bathtubs.
We've all seen the commercials. They work fairly well, but they don't work in everybody, and it's important for people to know that they're not a failure if those medications don't work. But the good news is we have things beyond that, such as injection therapy, vacuum devices, and ultimately surgery.
One of these vacuum, it's a VED is what it's called.
Right, it stands for vacuum erection device, and what it is an external device that actually patients can learn to use very easily, very safe, and really no reason why they wouldn't work other than issues related to spontaneity or lack of being able to use their hands.
Of course. Let's then talk about what you specialize in, and if people do need to know their treatment options. You specialize in all of these things.
Sure. Men's health is basically what makes up a large part of my practice, and what's really gratifying is that the satisfaction rate with these treatments and the patients being successful is very high, in the 90% range. And it makes up, it's a great part of the day when you can really bring that part of someone's life back.
It's a very important part of that life.
Absolutely.
I know there's a men's seminar coming up. I know that health is not necessarily something that men are very outgoing about, but this is an opportunity for them to get some information that may answer some questions.
That's right. A week from today at 1 o'clock at the Lifestyle Center, we will do a free men's health seminar. And we'll talk about a lot of these issues and some of the solutions that we can come up with for everybody.
Okay, so that's happening November 18th?
1 week from today, November 18th.
So it's 1 p.m. November 18th. Is it free to attend?
It is.
Should we RSVP if we're going to go then?
Please.
Okay. Yeah. And the information is right there on your screen. And what can people expect to learn there?
We'll talk about the etiologies. You know, not all the men's health dysfunction is related to diabetes. There are other problems. And then we'll talk about these options in detail. And we'll give a slideshow presentation. We'll have samples of all these things there that people can look at.
And with diabetes, obviously, I mean, it's something that seems to be more and more prevalent in our society. Diet is an incredibly big portion of that, and sometimes diet can maybe even turn back the ramifications of diabetes.
Very much so, yeah. Yeah, the incidence is growing every year, so awareness on diet and modification is very, very important.
If people want to learn more about your practice, how do they do so?
You can go to our website. It's usonv.com.
Awesome. It's a pleasure. Thank you so much.
As always, thank you.
Great having you. You're Urology Specialists of Nevada. They have 3 convenient locations to serve you. If you want more information on what we talked about this morning or the other services or that event we spoke about, just call the number or check out the website on your screen. They're also on Facebook and Twitter. It's a week from today, 1 p.m. Make sure you RSVP at that number there.